Fibrosis is a disease found in the lungs where an abnormally thick amount of mucus builds up in the lungs. This causes one not to be able to swallow or breathe properly, and you have to be fed through a tube put into one's stomach. This disorder is autosomal recessive, so there can be a carrier without an offspring having the disorder. In this family situation, there's one child who is 3 years old that has cystic fibrosis. The mother is 3 months pregnant with her second child, and the wife and husband separated a month ago. They have been referred to a genetic counselor, and their income is $35,000 a year, and their insurance is covered through the spouse's employer.
Nice to meet you. Nice to meet you. I was the one who talked to you the other day about my daughter who has cystic fibrosis, and I was curious to know more about the disease, so I was wondering if I could ask you some questions about it.
Of course.
Thank you. So, what is exactly cystic fibrosis?
Cystic fibrosis, also known as CF, is a genetic inherited disease. It causes sticky and abnormally thick mucus to build up in the lungs.
Oh, okay. What are some of the common symptoms of cystic fibrosis?
Some of the common symptoms include coughing, heavy wheezing, and the inability to breathe. As the disease progresses, the symptoms will get worse over time. The mucus can build up in the lungs and cause infections that are life-threatening.
How can a person get cystic fibrosis?
Well, CF is a recessive trait, which means that the parent can carry the disease but not have it themselves. CF is caused by a mutation in the CTFR gene. This gene is responsible for making sweat, tears, salt, and digestive enzymes. In order to have CF, the child must get 2 copies of the defective gene. If the child only gets 1 faulty gene, they will not have CF, but they'll be a carrier.
Oh, okay. So what are some available treatments for cystic fibrosis?
There are many types of antibiotics that the patient could inhale. These would fight against infections of the lungs. Another possible treatment is to do DNA enzyme therapy, which would thin the mucus. You could also take mucus thinners. Both of these would make it easier for the patient to breathe. Another treatment that would not require much effort is to take vitamin supplements of A, D, E, and K. Some people also use a feeding tube that gives them extra calories while they're sleeping. There are also many exercise therapies that would ensure you live a more healthy lifestyle. One last resort would be to get a lung transplant. This is risky because it's very expensive and the chances of it working are slim.
Oh, okay, I see. Are there any actual cures?
Currently there are no cures, but doctors are working to find one.
Oh, okay. So what are some helpful statistics on cystic fibrosis that I should probably know about?
One statistic is that every year about 1,000 new cases of CF are diagnosed. Another is that 70% of patients who are diagnosed by the age of 2. And more than 45% of the number of people who have CF are over 18 years old.
Oh, okay. That's really interesting. Thank you so much for everything. I will definitely use all this information in the future. Thank you so much. Hope to see you again. Nice to meet you.
Hi, I'm Caroline.
I'm Stephanie. So I was wondering if there are any educational resources that could benefit my child who has cystic fibrosis.
Well, to find out more about this disease, there is a resource library, an assistance foundation, a hotline you can call, a mutation analysis program, and a social security project. All of these things can be beneficial when you're not familiar on the disease you or your child has. But if you would like to learn more about it, you can research it. You can also meet with a genetics counselor in order to catch lung diseases early in patients with cystic fibrosis.
Oh, okay, that makes sense. So what kinds of medical resources do you have?
Well, there's a cystic fibrosis center that is made up of physicians, nurses, social workers, respiratory therapy, and genetics. An expert on diet and nutrition, a dietitian, will follow their patients to make sure that they are eating healthy. They also monitor things such as vitamin supplements to make sure their patients are receiving the proper nutrition they need because it's very important in the medical therapy in each patient. These dietitians would alter the nutritional care based on each person's needs. For therapy for cystic fibrosis, you can take pulmonary function tests to measure lung health. You can also take a plethysmography, which is a test to see how much air your lungs can hold.
Oh, okay, thank you so much. I will definitely use that information in the future. Thanks, good to talk to you. Hi, Dr. Schifron.
Hi.
Nice to meet you.
Nice to meet you too.
So my name is Stephanie. I was the one who talked to you about my daughter who got diagnosed with cystic fibrosis, and I am now 3 months pregnant with my second child.
What's your insurance policy?
My husband and I are separated, but we are covered by his insurance.
Cystic fibrosis can be really tough on families. As a genetic counselor, I would strongly advise you not to get an abortion. You have an insurance policy that will cover the treatment for cystic fibrosis if your child does have the disease. It would be pretty pointless to get an abortion, as the life of a child with cystic fibrosis is pretty close to normal. They can go to school, make friends, and get married just like any other person would. The only thing that differs is the life expectancy and the treatment. The life expectancy is currently 30, but that number is going up every year. Doctors are currently working on a cure that can permanently cure cystic fibrosis. If you want a book that will help your family with this, here it is. It is the Guide for Patient and Family Cystic Fibrosis.
Oh, thank you.
I think that if you read it, it will really help you get through this. I really hope that this helped your decision. I really could strongly advise you not to get an abortion.
Okay, thank you so much for
Sure.
your advice. It's hard.
Socially.
It's hard to accept the fact that there are some procedures that could make her life a lot better and not so hard to deal with, but we can't afford them. We feel so sorry for her and we are doing the best we can. We feed her liquids only through her stomach 4 times a day. We do everything we can, but we are so sad that she can't just be like the other girls on our block.
Financially, it's hard to pay for all the treatments and decide which ones are worth it. For example, to get 1 lung transplanted, it's $561,200, and for 2 lungs transplanted, it's $797,200. We cannot afford either of these treatments. There are other small things like changing your diet, but this doesn't help with their health greatly. Also, he or she could take antibiotics or vitamins and drink lots of water. These are environmental tips that we've been making sure he or she does, but they still have it in their body. It's hard for us to fix something like this with the money we have.
Yeah, and socially it's okay. I mean, we don't really have time to go out with friends or have time for her to have play dates. She's mostly at the doctor's, always having symptoms from her medications, like being tired often, so she can't really do anything. They look for possible cures or at least things to make her life a little bit better. But we can't usually pay for any of the procedures they want to perform on her.